Lori, how do you want to handle? Um,
So I just have a quick comment. We've learned a lot in this panel about the importance of understanding the culture of the person with whom we're dealing. And there's a couple of cultures I'd like to draw people's attention to. One is the disability culture. So folks that are born with or acquire disabilities when they're young quite often experience a form of discrimination, which is undertreatment. People assume they don't have quality of life. So that's one cultural orientation I haven't heard talked about, but that needs more attention. And then the other is age cohorts. So your 85 to 95-year-old who maybe went through the Depression or the World War II or both is going to be very different than your average 65-year-old who's a baby boomer. And I just think attention to those cultural norms are really important. And I don't know if I see nodding of heads. So if you had comments on that, I'd love to hear them.
I'll actually start and I'll say definitely I appreciate you raising the disability culture piece. And like I said, I'm going to answer this from the caregiver side. And so I think I've already shared my mother has progressive multiple sclerosis. She has extreme lower extremity spasticity. And so, and my mother was diagnosed with her MS once we got a final actual diagnosis of MS, we're going to say in her early 40s, right? So at that time, she's still undergoing the types of female screenings that we as females still go through. However, as her spasticity increased, we found ourselves in a place where, guess what, the screening recommendation saying a woman over 40 should have a mammogram, she should do it every single year. Well, we found ourselves at facilities that could not accommodate her because she couldn't stand in order to accommodate the mammography machine. Oh, and guess what? We no longer can do her pap smear because she has spasticity, and the ability for her to be able to put her feet in stirrups, no matter how short the process is, it is just not possible. So for me, that became an eye-opening experience because this is an experience for her who, as a woman who's now become disabled as a result of her condition, but how many other individuals with disabilities are out there? They're trying to participate and be active in their health care, but it's not designed, the environment and structural context in which healthcare also takes place is not nimble enough for them to be able to actively participate in their own healthcare. And so for me, that kind of raised that to the forefront. So we talk about the societal and the contextual piece, but I think we also have to begin to raise some level of consciousness around the structure, the dynamics, the physical dynamics in which healthcare also takes place.
and I'll just chime in with the pediatric side to that, because children with disabilities find an incredible number of assumptions, presumptions, and biases against them. And you know, the example that comes to mind is a good friend of mine who has adopted a child with Down syndrome that has cardiac disease and got rotavirus and was in the emergency room with dehydration. And there were 11 attempts at starting an IV, all unsuccessful, none of them with topical application of an anesthetic. And somebody turns to the dad and says, "Don't worry, he won't remember any of this because he's retarded." We could spend the rest of the day with stories of what happens to disabled children and the lack of attention to their suffering and discomfort. And so, yes, thank you for raising that as another population.
All these hand signals. I'm Joanne Lynn from Altarum Institute Center for Elder Care and Advanced Illness. And I just wanted, I greatly appreciate the input from all of you and the wonderful perspectives and stories. If you pull back to kind of a 20,000-foot look at inequities in our society and just the U.S. society, there's one other real impact on advanced illness, and it hits especially at the population that Diane was giving voice to earlier. We face an enormous number of people who are going to be living with serious disability, some because they survive these childhood illnesses or MS, but most of us in the room, simply because we get very old. And it's a wonderful thing that we get to be very old. But it depends enormously on a strong economy to be able to pull the resources needed to support very a large number of disabled people. And right now, we, unlike countries in Europe and certainly unlike Japan, have been singularly inattentive to the well-being of our disabled and minority children. So we have half of the children in the country being born into Medicaid, and we're talking about cutting Medicaid. We are systematically creating an inadequate economy to support large numbers of disabled people in the 2030s. If you look at that wonderful book, The Macroeconomics of Aging, that the Institute of Engineering put out, not the Institute of Medicine, the dynamics of our economy in 2030 are going to be calamitous unless we have highly productive 20 to 50-year-olds. And we are regularly creating non-productive 20 to 50-year-olds by so disadvantaging minority children, and sometimes just poor children. So I think that those of us who are concerned about advanced illness have to really take hold of the issue of how the economy will work with large numbers of disabled people. Otherwise, there simply will not be the economy to support people through the period of disability in old age, or for those who get stricken earlier, for those who have to live a long time with disability. So inequity is a real problem there.